We're ready to begin, Chairman.
Okay, yeah. Tanisha, would you please call the roll?
Yes, Chairman. I'll begin with Norman Boyd,
Here.
Roger Folsom,
Here.
Russell Crutchfield,
Here.
Anthony Williamson,
Here.
David Cruz,
Here.
Nelva Lee, Nelva Lee, I see you, Miss Lee. Maybe you need to unmute yourself.
I'm here. Thank you.
Thank you. Cynthia Rucker,
I'm here. My apologies on the other meeting. I was having mic problems.
thank you. Kenneth Davis, Kenneth Davis, thank you, Chairman. That concludes my roll call.
Thank you, Tanisha, and we do have a quorum this morning to conduct our business and welcome everyone to our meeting of Department of Community Health. We have a rather full agenda this morning. We will be asked to take up 7 different items related to medical plan assistance areas, and we'll be asked to vote on those. First of all, on the agenda, we'll refer to Mr. Crutchfield, our secretary, regarding the minutes of the March 10 meeting and ask if he has read those minutes and can recommend those for approval. Mr. Crutchfield, please.
Sure. Good morning, Mr. Chairman. I have reviewed the board meeting minutes for the March 10th board meeting, and I have found them to be correct and in order. I move that we approve the March 10 board meeting minutes.
Thank you. Is there a second to that?
Roger Folsom, second, Mr. Chairman.
Mr. Folsom has seconded that. All in favor, say aye.
Aye.
Opposed? Abstaining? Hearing none, the minutes of the March 10 meeting are approved. My opening comments, I recognize that our one of our board members, Mr. Childers, Russ Childers, has decided to enjoy life away from work a little more and has submitted resignation of the board, and I'll speak more to that later. But Russ was a chairman of the audit committee, and so therefore we need to appoint a new chairman of the audit committee, and I've asked David Cruz if he would serve in that capacity, and being very well qualified to do so, Mr. Cruz has accepted, and we appreciate that. So let the minutes reflect that the new chairman of the audit committee is Mr. David Cruz. Thank you. The other meeting that took place this morning was the Care Management Committee meeting, and I'll turn it over to Anthony Williamson for his report on their committee meeting.
Thank you, Chairman Boyd. We had another full meeting this morning with a lot of topics covered. Lynette first provided us some information on how we are handling the public health emergency, which is to cease on July 15th. We've received guidance from CMS, and we have a comprehensive plan focusing on 3 work streams: communication, IT systems, and policies and waivers. Big focus on the annual redetermination. Lynette shared that CMS is supposed to give us a 60-day affirmation of the PHE end date, which we're in the mid-May timeframe now, and that's not been received yet, but they have stated that they would send us that 60-day notice. We asked about if there's a lot of health entities, hospitals, providers, et cetera, that are have been affected by the PHE or have made modifications to their operations. And so we discussed any requests from guidance from all of those that have been impacted, or any concerns about the wind down timeline. And Lynette mentioned that the DCH will be reaching out to all of these providers and facilities who may have put, a lot of interim arrangements in place to see where those are now and just their ability to bring those down and if there's any concerns. So that was it regarding the PHE. She also updated us on the status of the CMO procurement. Really appreciate the work that's being done to gather information related to that. They are preparing an RFI to solicit feedback from all interested parties and sister agencies. So they'll be really gathering a lot of information to assist that CMO RFP to go out. That RFP is slated to go out by the end of the calendar year 22 or early calendar year 23. She also updated us on value-based purchasing under our managed care programs. This is subject to HB 911, the appropriations bill being approved. But the goal of the value-based purchasing program is to improve our health outcomes. A portion of the cap payments are held back and tied to performance on metrics. And then there's an ability to earn that amount back based on performance, and some of that is shared with the providers. We next move to Dr. Holloway and Don Trisha, who gave us an update of the Georgia Families 360 dashboard, which applies to our programs, Medicaid programs for children with AmeriGroup, focusing mostly on HEDIS measures and 4 pillars around access, quality, stewardship, and service. We noticed most of the measures did achieve 4 and 5 stars. And there was a question about this information being available publicly from our board members and how much it would benefit if this was made available. And Dr. Holloway said the goal is to have this dashboard made available to the public online by the end of the quarter. And we closed with Lynette commenting that they will keep us updated on the unwind of the PHE and all the further procurements that they are working on. And that is the end of my report, Chairman Boyd.
Thank you very much for that comprehensive report. And are there any questions or comments from board members? Hearing none, we thank you again for your report, and we'll move to the next item on the agenda, which is the commissioner's report, and I will turn it over to Commissioner Noggle.
Good morning. Thank you, Mr. Chairman. Good morning, members of the board. Certainly been a busy spring at DCH, and I think we'll continue to be pretty busy over the course of the next summer. We've obviously been working diligently to analyze bills that passed out of the legislative session, in addition to things that might be included in the budget. As a friendly reminder, as you just heard from the committee report, the governor has 40 days after the end of the session to review both the budget and those bills to make final determination on final adoption or not, or take some other action. So while we're planning for implementation of many of those items, anticipating signature, we always know that we can't get too far ahead of ourselves until final things get done. So while we have 7 items on the agenda today, I think 6 of them are still contingent on final adoption of the budget. So we're trying to get ahead of a couple of things and be ready to go. Anticipating that, but certainly won't submit anything to CMS for final approval by the feds until we get the governor's final signature on that budget. So we'll keep you posted on those. We'll have another set of items stemming from either legislative or budget or some other projects coming in June. We're anticipating having 2 board meetings in June so that we can get all the necessary initial adoptions, public comment, and then final consideration on many items done so that many of these items will be ready to take effect on July 1. A couple of very specific updates to share with you, and some of them will be repetitive of what you've heard from the Care Management Committee meeting report this morning. But first, we've talked a couple of times about this, our efforts to initiate a new set of directed payment programs. That first program, Georgia Aid, was considered earlier this spring by the board, and we've officially submitted that to CMS for their consideration. And we're engaged in active conversation back and forth with CMS as they do their consideration and evaluation of that program. There are a couple of other pieces that we've talked about and other steps related to that that we'll be bringing to you next month. But taken in concert, if all approved together by CMS and this board, will ultimately provide significant new Medicaid funding to our hospitals and providers across the state with a specific emphasis and benefit to our rural hospitals. So we're happy to keep that work moving into June. We've submitted renewals on 2 of our existing DPP programs that are an important part of this as well, our public hospital DPP and our provider or physician DPP. In early June, we'll bring you that next round. Again, the next one we're calling Georgia Strong, which is a program that will benefit our teaching hospitals. Additionally, an extension of that public hospital directed payment program to include our private hospitals, and then some other rule and language changes related to our DISH methodology. So very exciting that work is still moving forward and on track. Again, with all the requisite approvals, we're not sure how long it would take CMS to consider all those things, but whenever they do, so long as we do our part timely, they would be retroactively effective to July 1, pending those final decisions. We're also working on a new upper payment limit program for our ambulance providers that we've been working on in concert with them for a couple of months. I think we're waiting to get a little bit of additional data, but we look forward to bringing that to you at some point over the summer as well. You heard a little bit about the managed care reprocurement and that effort, still in the same timeline. We're moving beyond our initial early analysis and conversations to this period where we're going to start engaging our external stakeholders. You heard from the Care Management Committee that we are anticipating issuing an RFI or request for information probably at the very end of May or early June, just to invite interested parties, be it potential bidders, advocacy organizations, or others, the opportunity to have their voices heard and their input considered in a very thoughtful and planned process. We'll also be reaching out to do some specific stakeholder engagement conversations and inviting some folks to the table with us, inclusive of our sister agencies and others, to really engage in a dialogue with us about what's working, what's not working, what we all hope to achieve in the next round of managed care. So we're excited about that. You heard a little bit about the public health emergency. CMS reissued guidance this week, reaffirming their commitment to give states 60 days notice before they terminate the public health emergency. Again, it's currently slated to end July 15th. So by my watch, I would think by tomorrow or Monday at the latest, if we haven't heard that they're ending that, then we're probably going to be seeing an extension. So regardless of that, though, this unwinding, it's called, will happen at some point. And so there is a lot of work going on to figure out all the moves and all the steps that we're going to need to take in conjunction with the Department of Human Services and DFACS, who handles the actual eligibility redeterminations for our Medicaid members, of what that's going to look like. There will undoubtedly be a very large communication effort to our members about this. And we're going to start encouraging them to update their contact information in a timely manner so we know where they are and can make sure that they get redetermined timely. But we'll keep you updated as those plans progress as well. Finally, on April 21st, the governor issued an executive order creating the Healthcare Workforce Commission. The order stated that that the commissioner of the Department of Community Health will serve as the chair. So I look forward to that opportunity. It's a really important effort and initiative, I think. Obviously, we've talked about workforce a lot and the state of that. And so looking forward to the additional 14 members to be appointed to that commission in the coming weeks and getting that work started. We'll also work pretty closely in that effort with the Georgia Board of Healthcare Workforce and the Office of Healthcare Strategy and Coordination. And ultimately, like kind of a tight timeline, by December, our task will be to develop some really specific and tangible recommendations that hopefully will lead to an improvement in our workforce pipeline, including retention and the resilience of our current workforce. In kind of other agency news, just share a couple of things with you. One of my goals as commissioner is to engage our staff in opportunities within the community we serve when possible. In April, we had, I think it was around 20 or 25 staff join me for Georgia State University's GSU Cares Day. We went and volunteered at the Atlanta Community Food Bank, and that was a really awesome experience. This past week, it's always the first full week of May, we celebrated Public Employees Recognition Week, which was really, really successful. Honestly, we had a lot of folks back in the building. It was the first time that I actually saw this room that we're in almost full. We had a lot of folks come in. It was great to meet so many of our staff in person finally. Shout out, special kudos to our human resources and communications teams for organizing so many events that week, both in person and for our folks that were virtual and or that live around the state. That week concluded with a team of 49 Department of Community Health staff members and their friends and family joining me and participating in a fundraiser run walk event that supported the Grady Health Foundation. We were very proud to bring home an award for the largest team, in addition to raising just over $5,200 in support of the foundation. So I look forward to future opportunities like that with our staff to engage in the providers that we serve out in the community. So super happy about that. And then finally, as I like to do, I'd like to just briefly recognize our staff that are celebrating milestones this month. Celebrating 5 years with the department are Pauline Collins, Cheryl Dean, Kimberly Moore, Anthony Moss, Evelyn Murphy, Cynthia Petty, Karen Purvis, and Valerie Quaker. Celebrating 10 years, Marvis Butler, Renee Day, Luana Marcus, Patricia Whitfield, Mark Becker is celebrating 20 years, as is Tiffany Blockham, Sharon Collins, and Rosemarie Duncan. And celebrating 25 years of service with the state is Beverly Henry. So thank you to those staff that are so committed to the work that we do and to what we're trying to achieve every day. Mr. Chairman, that concludes my report, but happy to answer any questions from you or members of the board.
Okay, thank you, Commissioner. Are there any questions, comments from the board, please? Hearing none, I'd like to add our recognition to and thanks for all your staff that participated in all the different community involvement events that you described. That's great stuff. To move into our agenda items that we'll be asked to consider, the first in the medical assistance plan will be presented by Lynette Rhodes. So Lynette, you may begin, please.
Good morning, Chairman Boyd, members of the board, Commissioner. Thank you for the opportunity to present. Pending enactment of House Bill 911 and approval by the Centers for Medicare and Medicaid Services, the Department of Community Health proposes to eliminate the attestation requirements and reimburse all eligible providers at the enhanced rates for claims with dates of service beginning July 1, 2022 and after. By way of background, the Affordable Care Act allowed enhanced rates for physicians with a primary specialty designation of family medicine, general internal medicine, or pediatric medicine during calendar years 2013 and 2014. The enhanced rates were effective for dates of service beginning January 1, 2013 and ending on December 31st, 2014. The enhanced rates applied to both fee-for-service and managed care, and it applied to codes ranging from CPT code 99201 through 99499 to the extent that those codes were covered under the state plan. Subspecialists within the three primary care categories were also eligible for the enhanced rate, as well as non-physician practitioners, such as physician extenders or mid-levels, if they practiced under the supervision of an eligible physician. In order to receive the enhanced rates, physicians and physician extenders were required to attest that they met certain requirements under the ACA. They were required to attest that they were board certified in the designated specialties and subspecialties. Alternatively, physicians who were not board certified attested to having at least 60% of all codes billed by the physician for E and M codes. Those are evaluation and management codes and vaccine administration codes. The providers could attest by completing a form in the GAMIS system or by submitting a paper form. The providers who were eligible to receive the enhanced rates but failed to attest during calendar years 2013 and 2014 did not receive the enhanced rates. As mentioned, those enhanced rates ended on December 31st, 2014. Subsequently, the department was appropriated funds to continue those rate increases over 3 subsequent years. And those appropriations were made through House Bill 76, House Bill 751, and House Bill 444. The enhanced rates were only allowed to continue for those providers who previously attested under the ACA, and also for providers who were newly licensed in the state of Georgia as of January 1, 2015. In the interest of equity, the department is eliminating the attestation requirements and is increasing the reimbursement rates of all currently enrolled eligible providers that failed to attest previously and that fall within the eligible specialty and subspecialty designations. This applies to physicians and physician extenders, newly enrolled providers that fall within the specialty and subspecialty designations will also receive the enhanced rates. The projected cost impact for removing the attestation requirements for state fiscal year 2023 are as follows. Total funds represent $252,878,481. And this covers the aged, blind, and disabled population, low-income Medicaid population, and also Peach Care for kids. Of that total amount, federal funds represents $169,207,787, and state funds represent $83,670,694. An opportunity for public comment will be held on May 17th, 2022 at 11:30 a.m. via Zoom. Individuals wishing to comment in writing should do so on or before May the 24th, 2022. I will pause now for any questions from the board.
Are there any questions, comments from the board, please, for Lynette? Hearing none, is there a motion to approve for the enhanced rates that she has described? Is there a motion for initial adoption?
Cynthia Rucker, I move.
Yes, Cynthia Rucker has so moved. Is there a second?
Russell Crutchfield, second.
Russell Crutchfield is second. All in favor, say aye.
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 Opposed? Abstaining? Hearing
This
none.
is
it is
Dr.
approved.
Davis. I'll abstain.
I'm sorry, please.
This is Dr. Davis. I'm going to abstain because of my role with physicians in Northwest Georgia.
Yeah, but let the minutes reflect that Dr. Davis has abstained due to his roles in his business. But the motion has carried.
Thank you.
Thank you very much.
Thank you.
Next, we will hear from Kim Morris, and she has 4 different items in the area of medical assistance plans that she will present, and we will be asked to vote on for initial adoption as well. Please proceed.
Good morning, Chairman, Board, Commissioner, and the members of the DCH Board. Today, I'm presenting for initial adoption pending enactment of House Bill 911 and approval from the Centers of Medicare and Medicaid Services, an increase for selective obstetric and gynecological codes to the 2020 Medicare reimbursement rates. This is going to be effective July 1, 2022. The rates increase in these codes will enhance the changes that Ms. Rhodes just previously presented related to the physician enhanced rates. Included in the briefing document and public notice is a listing of the selected codes and the corresponding rate increases. The changes to the rates will apply to the Medicaid low-income program, excuse me, with total funds increasing by $2,443,442. An opportunity for public comments will be held on May 16, 2022 at 1 p.m. via WebEx, and written comments are due to the department on or before May 23, 2022. At this time, I'll pause to see if there are any questions.
Any questions, comments from the board, please? Hearing none, we're being asked to vote on this as initial adoption. Is there a motion to adopt it as an initial adoption?
Roger Folsom, motion for initial adoption, Mr. Chairman.
Mr. Folsom has moved for the approval. Is there a second?
Second.
I'm sorry, I didn't catch.
Second by David Cruz.
David Cruz has seconded that. All in favor, say aye.
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 Opposed? Abstaining? Hearing none, it has been approved. Thank you very much, and you may move to your next area.
Okay, today I'm presenting for initial adoption pending enactment of House Bill 911. Incentives for Medicare and Medicaid services, an increase in the mechanical ventilator per diem from $589.62 per day to $707.54 per day. This is also effective July 1 of 2022. Excuse me. In fiscal year 2010, the department established a specified cost-based reimbursement rates to pay qualified nursing facilities for the specialized care of ventilator-dependent rates. This change in the rate will apply to the Medicaid Age, Blind, and Disabled program, with total funds increasing by $5,024,163. An opportunity for public comments will be held on May 18, 2022 at 11 a.m. via WebEx, and written comments are due to the department on or before May 25th, 2022. At this time, I'll pause to see if there are any comments.
Any questions or comments from the board, please?
Mr. Chairman, this is Russell Crutchfield. I
Yeah.
have a quick question.
Yes.
Thank you, Kim, for presenting this motion. The ventilator care, does the type of service include care for COVID patients that may go on ventilator care?
It's for all patients that are receiving ventilator care. So it wouldn't, if it's a COVID patient that's in the nursing home and they're on a ventilator, then they would be covered as well.
Okay, thank you.
Any other questions, or comments? Hearing none, is there a motion for approval for initial adoption?
Motion to approval, Dr. Lee.
Dr. Lee has made the motion for approval. Is there a second?
Second, Cynthia Rucker.
Cynthia Rucker has seconded that. All in favor, say aye.
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 Opposed? Abstaining? Hearing none. Kim, you may move to your next topic.
Okay, presenting for initial adoption and pending enactment of House Bill 911, incentives for Medicare and Medicaid services, a 10% increase to long-term acute care hospitals and inpatient rehabilitation facilities. This is also effective July 1, 2022. Included in the briefing document and public notice is a listing of the long-term acute care hospitals and inpatient rehabilitation facilities and the corresponding increased rates by hospital and facility. This change will impact the Medicaid Age, Blind, and Disabled program, with total funds increasing by $4,465,807. An opportunity for public comments will be held on May 18, 2022 at 1 p.m. via WebEx, and written comments are due to the department on or before May 25th, 2022. At this time, I will pause to see if there's any comments or questions.
Any comments or questions from the board, please? Hearing none, is there a motion for approval for initial adoption?
Russell Crutchfield, move to pass.
Mr. Crutchfield has moved to our approval. Is there a second?
Second, Mr. Chairman, Roger Folsom.
Roger Folsom has seconded. All in favor, say aye.
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 Opposed? Abstaining? Hearing none, it is approved and you may proceed.
Okay, this is my last presentation. I'm also presenting for initial adoption and pending enactment of House Bill 911 and approvals from the Center of Medicare and Medicaid Services, a 10% increase for 2 dental extraction codes, and a 7% increase for 17 specific dental restorative codes, and this is also effective July 1 of 2022. Included in the briefing document and public notice is a listing of the selected codes and the corresponding rate increases. This increase will apply to the Medicaid age blind and disabled program, $646,139. The low-income Medicaid program, $2,860,925, and Peach Care, $336,490. An opportunity for public comments will be held on May 19, 2022 at 1 p.m. via WebEx, and written comments are due to the department on or before May 26, 2022. At this time, I'll pause to see if there are any questions or comments.
Any questions, comments from the board, please? Hearing none, is there a motion for approval for initial adoption?
Motion for approval, David Cruz.
Mr. Cruz has made the motion for approval. Is there a second? Is there a second to that motion?
Nelva Lee.
Second,
I'm sorry, I didn't catch who that was.
Dr. Lee, second.
Yeah, Dr. Lee has seconded. All in favor, say aye.
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 Opposed? Abstaining? It is approved. Thank you so much, Kim, for your presentations this morning.
you.
Thank you. Final two items for consideration. Turn it over to Brian Dowd, who will make those presentations. Brian?
Thank you, Mr. Chairman, Commissioner, and members of the board. I am presenting today for initial adoption, the establishment of a new service known as Behavioral Support Services, effective July 1st, 2022 with DCH Board approval, Centers for Medicare and Medicaid Services approval, and pending enactment of House Bill 911, the Department of Community Health is proposing to establish behavioral support services for children and youth under the age of 21. Behavioral support services will be a standalone service within the Georgia Pediatric Program, as well as a key service included in a larger package of services under development by DCH that will encompass therapeutic services for children and youth. Behavioral support services are one-on-one, face-to-face behavior management interventions and stabilization services provided in the home or community settings designed to teach and reinforce behavioral goals through training and direct support. Behavioral support services are designed for children and youth who meet serious emotional disturbance, autism spectrum disorder, traumatic brain injury, and/or other developmental criteria with behavioral symptoms. Services will be authorized according to medical necessity criteria via prior authorization. Behavioral support services are provided by a trained and supervised behavioral aide. The aides work with the member, family, caregivers, teachers, and other key individuals. They're part of a member's life in order to meet the plan of care treatment goals. The rate of reimbursement is funded in accordance with the DCH American Rescue Plan Act of 2021 and supported ongoing by state appropriations pending enactment of House Bill 911. Proposed July 1st, 2022 rates are $6.63 per 15-minute unit, provided under billing code S9122 with a U1 modifier. The proposed reimbursement establishment is estimated to increase expenditures in age blind and disabled Medicaid by $53 million, total funds $53,003,402, of which $17,079,021 will initially be funded by the American Rescue Plan Act and then by state appropriations. An opportunity for public comment on the proposed change will be held May 19th, 2022 at 11 a.m. via Zoom. Individuals wishing to comment in writing on the proposed changes can do on or before May 26th, 2022. If you have any questions, I would be happy to answer them at this time and we respectfully request your initial adoption of the establishment of behavioral support services.
Any comments or questions from the board, please? Do I hear a motion for approval for initial adoption for this new services?
Mr. Chairman, I make a motion. Cynthia Rucker.
Cynthia Rucker has made the motion for approval. Is there a second?
Russell Crutchfield, second.
Russell Crutchfield has seconded that. All in favor, say aye.
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 Opposed? Abstaining? Hearing none, it is approved. Brian, thank you so much. And you may proceed.
Thank you. Last one. I am also presenting today for initial adoption, a rate increase for skilled nursing services in the Georgia Pediatric Program, or GAP, effective July 1st, 2022, with DCH board approval and pending enactment of House Bill 911. The Department of Community Health is proposing an increase in rates of reimbursement for pediatric in-home skilled nursing covered by GAP. The increase in rates of reimbursement is funded in accordance with the DCH American Rescue Plan Act of 2021, and which was approved by the Centers for Medicare and Medicaid Services and supported ongoing by state appropriations pending enactment of House Bill 911. DCH proposes to increase the rate of reimbursement for registered nurses, or RNs, and licensed practical nurses, or LPNs, within GAP by 10%. Code S9123 for RNs would increase from $10.63 per 15-minute unit to $11.69 per 15-minute unit. Code S9124 for LPNs would increase from $9.31 for 15-minute unit to $10.24 per 15-minute unit. The proposed reimbursement rate change is estimated to increase total expenditures within the Age, Blind, and Disabled Medicaid program by $8,573,155, of which $2,841,144 will initially be funded by the American Rescue Plan Act and then a state appropriations. An opportunity for public comment on the proposed change will be held May 20th, 2022 at 10:30 a.m. via Zoom. Individuals wishing to comment in writing on the proposed changes can do so on or before May 27th, 2022. If you have any questions, I would be happy to answer them in this time and will respectfully request your initial adoption of the rate increase for skilled nursing services within the Georgia Pediatric Program.
Any questions, comments from the board, please? Hearing none, is there a motion for approval of initial adoption?
Roger Folsom, motion for approval,
Roger
Mr.
Folsom
Chairman.
has made the motion for approval. Is there a second?
Second by David Cruz.
David Cruz has seconded. All in favor, say aye.
Aye.
Aye. Opposed? Abstaining? Hearing none, it is approved, Brian, and thank you very much.
Thank you.
You know, we moved through several items here today, and many of you may wonder how we do that in the manner in which we do. And one of the reasons we're able to do that is because of the advanced materials that the department prepares and spends a lot of time preparing for the board. And we receive those a week in advance. So we've all had an opportunity to review those materials in advance. And we do very much appreciate that kind of work that all of you put into this and for our benefit. Thank you with that. And as we move ahead, is there anyone that knows of any new business that needs to come before the board at this time? Hearing nothing of new business, I have one other item I would like to cover before closing, and that is to recognize a departing member of the board, Mr. Russ Childers, who I've had the pleasure of getting to know pretty well over the last several years that he's been a part of the board. And Russ has called me a few weeks ago and said that he was submitting his resignation because he wants to spend more time doing things and enjoying life in the family and not as much time at work. And we wish him the best in that. But to recognize the contributions that Russ has made, not only to DCH board, but also other areas in the healthcare business in the state of Georgia. and in his hometown community of Americus, Georgia, where Russ has been a community leader for many years. And with that, the governor has presented to Russ in this leather binder here, a nice recognition letter accommodation. And I'll just briefly read that for you because it's quite revealing and about Russ himself and what contributions he's made to the state and to the healthcare industry. Accommodation, Russ Childers has served the state of Georgia for 8 years as a member of the Board of Community Health, playing a key role in improving the health of all Georgians. And Mr. Childers was appointed to the Board of Community Health in 2014 by Governor Nathan Deal and has served as the chair of the audit committee since his appointment. And Mr. Childers has worked as a life and health insurance agent for nearly 50 years, being recognized in 2000 as the Health Underwriter of the Year in Georgia and serving as president and legislative chair of the Georgia Association of Health Underwriters. And in 2010, Mr. Childers served as president of the National Association of Health Underwriters and is a recipient of the 2014 Harold R. Gordon Memorial Award. And the state of Georgia is honored to recognize Russ Childers for his many years of service and contributions to the health and well-being of our state. Now, I, Brian P. Kemp, Governor of the state of Georgia, do hereby commend Mr. Childers. And with that, we will be presenting this to Russ in due time. Thank you also very much. And if there's no other comments or questions from the board, our meeting is adjourned. Thank you.